Good afternoon. Welcome to St. Clair County EMA Daily Briefing. We're here today with some more numbers, along with Chairman Kern and Sam Behrman from the Health Department. Sam, the numbers keep going up, and I know you've got some more news today.
They do. As we have done in days past, the numbers that we will be reporting here today are St. Clair County residents that have been tested. As of today, we are at 707 that have been tested. 105 that are positive, which is an increase of 11 from yesterday. And those are a male in his 30s, a male in his 50s, a male in his 70s, one male in his 80s, 3 females in their 60s, a female in her 30s, 2 females in their 50s, and 1 female in their 40s. We are at 477 negative test results, with 125 tests that still remain pending. We do have some sad news today as we are adding 2 additional deaths from yesterday, so we are at a total of 6. One was a male in his 50s and the other was a male in his 70s, and both did have underlying health conditions. And our thoughts and prayers go out to those families and those healthcare workers that took care of those patients. For state totals, we are at 75,066 that have been tested. We are at 15,078 that are positive, and that is an increase of 1,529 since yesterday. And we are at 462 deaths, which is an increase of 82 since yesterday. So we are seeing numbers in all categories go up today. I would like to remind everyone that St. Clair County Health Department is still open. We are, however, open by appointment only. So if you have any questions about the services that we have, please call 233-7703 for any questions that you have or any assistance that we can offer you. And now I will turn it over to Chairman Kern for his update.
Well, Sam, let's talk a little bit
Sure.
about your report. On April 1st, we had 50 COVID positives. Today, we're at 105. What's involved with you keeping track of all these numbers and the sexes and the ages? And of course, you've got other information, I'm sure, that that HIPAA protects.
It does.
But what's involved with that and at the health department?
So criteria for testing has changed. As we have seen, it's developed, and we've seen changes along the way. But what happens is the emergency departments would call the health department to say, we have a patient that we think might meet criteria. We would go through the criteria that the Illinois Department of Public Health has been put out, and we say yes or no, they meet this criteria, and then we're going to test them, or no, they don't meet the criteria at this time, we cannot test them. We would collect the specimens, and we are sending our specimens to a lab down in Southern Illinois, which is a state laboratory, and they are looking at now are anywhere between a 2 to 4 day turnaround. We're keeping closer to the 2-day end, which is great, but as we increase the amount of tests, obviously turnaround time is going to be a little longer. And then we get faxed the results from those lab reports, and we put them into a very large spreadsheet, and we look at where those patients were tested. We list them by hospital, so we know which hospital they're at, and then we would notify the patients themselves, and we would follow up with our contact tracing to any people that had contact with them during their symptomatic time.
So the emergency departments you talk about that contact you, that's Memorial?
It's Memorial, both Memorials, Belleville and Shiloh, as well as St. Elizabeth's. When we do our daily numbers, Eastside Health District reports their numbers to us, as well as Memorial, the tests that they do that are not run through our state labs, the ones that they do through their drive-through clinic, they report those numbers to us daily. So every day around noon, I start reaching out and getting those numbers, and then we compile them for our daily briefings here with you guys.
There's a small discrepancy between our numbers sometimes and the state numbers.
Yes.
Where does that come from?
So we can only report in the briefings what is reported to us. So what we are finding right now is that it's the private labs that have those results that are not being forwarded to us. So we're working on closing that gap. But in the meantime, we can't report anything that hasn't been reported to us. But we are working on closing that gap.
Okay. How are the staff? I know is working a lot of long hours. How's everyone holding up?
You know what? I can honestly say we have the best team over across the street at the health department. I mean, we are all in it together. People that outside of their normal duties, they're coming up and saying, hey, what can we do to help? and they are willing to do anything. We just have a great team over there, and I can't be more appreciative and more thankful for them. Everybody's putting in a lot of time and hard work.
Sam, do you think that now that we're seeing a peak, the deaths are increasing in New York, but I think they say the number of cases is leveling off. What are your instructions here in the central part of the country? We are behind that curve, aren't we?
We are, and we are taking our guidance from Illinois Department of Public Health, Dr. Ezike, and we are still, at least from what they're saying, we are still about a week and a half out from what they think is going to be our peak, where we're going to hit our top numbers. But that still could change. This virus is ever evolving. It's changing. And there is new guidance that comes out almost daily from Illinois Department of Public Health. So we take their lead, but it's still looking like it's about a week and a half out before we hit that.
So stay home, social distance.
Stay home. Continue to the shelter in place. Continue the hand hygiene. And I thought a really important fact that Dr. Bodeman mentioned yesterday is even when you're home, socially distance from yourself from those even within your home. If you've got plenty of room on the couch, put some room between you. Our goal is to keep everyone as safe and healthy as possible. And I know the last thing we want to do is bring that virus home and give it to someone within our house. So, even keeping some social distancing space between you and those at home is a good idea.
Just because you don't feel sick doesn't mean that you can't be a carrier.
That is absolutely correct. We've seen some cases where we've been able to narrow it down to where they have been and people that they have been with, and no one has been symptomatic. So, and it has to come from somewhere, so it is very possible that you could have this virus and not be symptomatic.
Herb, do you have any questions for Samantha?
Not the questions, just I don't know what we do without Sam and the health department. We heard today Barb is going to be working from home, so we glad to hear Barb is on the mend.
Yes.
So, but Sam and the staff, everybody over there has been great to work with. But we got a long way to go. When we talk about that peak, we've said this. The doctors that we've had on have said the same thing. Don't get complacent. It's not like the light switch. It's not going to go off and everything's going to be okay. We're still got a long way to go.
And I know it's hard for everyone with the weather becoming so nice out. We want to get outside. We're getting a little stir crazy. But just think about the long run, and the sooner that we can put an end to this, the sooner we can get back to normal day-to-day life. And I think that's what that's our goal, is for everybody to get back to normal.
Yes, I agree.
So.
Great. Thank you, Sam.
Absolutely.
So with Sam's increased numbers, we have the new zip code report for today. So in zip code 622206, there are 9 positive COVID cases. In 62208, there are 11. In 62220, there are 7. In 62221, there are 16. In 62223, there are 11. In 62226, there are 14. In 62258, there are 7. And in 62269, there are 14. So I think we added zip code or 2 today because of the increased numbers, which just says to all of us, we are continuing to grow these numbers. Now's the time to stay home. As we said yesterday, let's not take our foot off the gas. Let's not take our eye off the ball. Let's keep doing the things that we've been doing, and we'll make sure that we are going to have as few deaths as possible. A number of people are in the hospital and on ventilators. That is no place to be. That is a difficult situation, and in the hospitals, it's very labor intensive and time intensive, and the ventilator is really they're scarce, and so let's try to keep everybody well. Herb?
You're correct, Chairman. A couple of things before I get into the EMA report. We had a guest scheduled for today. It was a RN from one of the local hospitals. But as you can imagine, they're busy, and so we got the late minute call that they weren't going to be here today, but there will be a guest here with us tomorrow. they got to take care of the patients, and that's foremost on their mind right now. On the EMA side, a busy day. The conference call with the hospitals and EMS providers again this morning. A lot of good networking there with that group of individuals. Had a conference call with IDPH. Sam and you talked about the difference in those numbers. So we think we're getting closer to having that resolved. Sam's going to be working on that tomorrow. But that conference call proved to have a little bit more positive information. So hopefully when we get those messages from you viewers that why is the state website saying one thing and you're reporting another, we're hopefully going to get that gap closed like Sam said. So just bear with us on that there. We had a conference call with the 911 director today, making sure everything is okay on our 911 centers. I mean, a lot of times those telecommunicators kind of get pushed off to the side, but they're actually the first link in that chain when people are needing help. So our 911 state director was curious of how everything's going on in the PSAPs around the state. So that was another conference call. Did some more distribution of the supplies. Was able to help out one of the homeless shelters in East St. Louis that needed some supplies, taking care of them. One thing I wanted to really mention out, the Sheriff's Department, Sheriff Watson sent his report over. He had a detail out last night, and they made about 20 different notifications to people who were gathering in large groups, and he wanted me to share the information. He gave me the list of them that they've even got a farm now they're giving these people, saying you've been warned, you've been notified, you can't do this. So if they come back and see them in these same locations, then it could be a different ending to that. It's we talk about it all the time. We're doing this every day. And I know you're keeping in contact with all the department heads. They're all stepping up to the plate. The county government has to go on. This is important. And just to show you, the government has to go on. We've got some severe weather coming tonight. We wanted to make sure you're all aware of that. Sometime between the 5 and 8 p.m. hour, they're saying golf ball size hail, 60 mile an hour per mile winds. About an inch of rain, so the rivers are rising. We're watching that also, but our main focus has been the COVID-19 because when we're talking about adding more deaths there in St. Clair County, we keep saying every day we don't want those numbers to rise, but we can't stop that. The only way you're going to help stop that is like all these communities are doing. Columbia is doing a public service announcement, their police department telling you stay home. Millstadt's done one, Muscuda, O'Fallon. I talked to the mayor of Fairview Heights. He's got a good couple friend that's stranded in Florida. They can't get back home. So it's affecting everybody. So for those of you who are just, it's nothing, when you look at these numbers across the state, 82 deaths added since yesterday. We added 2 more here in St. Clair County. And as we're sitting here, as much as we don't want it to happen, we can tell you those numbers are going to rise. And I keep telling you, you can either be a part of the solution or be a part of the problem. And if you don't stay home like you've been asked to do, then you're going to be a part of that problem. So I just asked before we leave, and the ladies come back and translate this into our Spanish communities, just remember this: stay home and stay alive. We'll see you tomorrow around 3:30 back here with the Daily Briefing.